Good afternoon, everybody. Bob Brisky here at Pinnacle Financial Services. Welcome to the webinar. Pinnacle, October 1st, ready to hit the ground running here for the upcoming AEP. So welcome to our presentation on the new Connect4Medicare 2022 plan information. We're going about 45 minutes-ish. I'm expecting today we're going to record this as well. So first off, you should be seeing our Pinnacle website. It's P like Paul, F like Frank, S like Sam, insurance.com. Just a couple of quick things on that. First off, I'm going to advise everybody to be able to get a hold of us for additional questions after the call. So under the About, if you go to Contact Our Team, you're going to see a Sales and Support. You can use either of those. If you click on the Sales, for example, of course, our phone number is up here on the left-hand side, the 800-772-6881. You can also email the support at pfsinsurance.com. But then as you go down, you can see we've got a extension of 7731 that you can dial, or you can dial right to any of our sales team, like Cody here, extension 7723. You've got Dustin at 7706, so on and so forth. So a lot of easy ways to get a hold of the team here at Pinnacle with additional questions that you may have. As we're coming into AEP, I know everybody's been getting ready to go here. If for any reason you feel like maybe you don't have all your irons in the fire when it comes to leads or marketing, also get a hold of your sales team. You can see here under leads and marketing, we've got a lot of opportunity here to try and see more people this AEP. So under leads and marketing, you can see there's a lot of good stuff: telemarketing, virtual sales, T65, Facebook marketing, direct mail, tried and true, all the different programs that are available to you as an agent of Pinnacle Financial. So again, feel free to touch base with the team and they'll definitely help you out with whatever you're looking for. So today, really what we're going to talk about the Connect4Medicare. Connect4Medicare has two different platforms that we make available. And if you go on our website and under online enrollment, you can see there's a Connect4Medicare. So we make available to all agents contracted and ready to sell with Pinnacle Financial two different platforms, the ESignature and Sunfire. So both are available to every single agent who is contracted and ready to sell. You can use either, both. It's completely your preference. What you're going to see today is, though they don't look exactly the same, both of the platforms are in about a 95% do the same thing ratio. So a lot of it comes down to personal preference on which one you would like to use. Both are available, no charge, your call. Again, ESignature. So ESignature has a specific link for the 2022 plan data. So again, that's anybody who's looking for a 2022 effective date. If you're still writing individuals looking for a 2021 effective date using ESignature's platform, you can see there's a separate link here. You should continue to use this one for 2021 effective dates. And then Sunfire does a little bit different. There's only one link. When you go into the Sunfire account, you can toggle between the 2021 plans versus the 2022 plans. And when I go in there, I'll show you how to do that. It's very simple. So this way, depending on the effective date your client is looking for, you can make sure that the right plans are showing. Shortly, this 2021 ESignature button will go away, as we won't have the ability to do any 2021 effective dates any longer, and it'll just be the two buttons that'll be here. But we're still probably a little bit away from dropping to 2021. So today we're going to talk about 2022 stuff. I'm going to start with ESignature. Again, type in questions as you have them. I'm going to run through. It is being recorded, so you'll have the ability to listen again at your convenience. So I'm going to go into our test site here. So our training and log right on in. This is, again, 2022 plan. So those of you that have been in ESignature previously, this is a little bit different look on the dashboard page. So what they did, which is really, I think, a great enhancement, is they are given a lot more reporting capability in the dashboard. So when you're logged in, you're going to be able to run reports on your enrollments, scope of appointments, and then also we're going to talk about HRAs, the health risk assessments that can now be done by using not only the Connect4 but also the Sunfire platforms. You still get paid from the carriers. Again, the health risk assessments are just the quick phone calls that you can conduct after you enroll an individual, and you get paid, which is nice. You get paid in real time for the HRAs, and the amount can vary by carrier, and we'll touch base a little bit on that as well. So here on the dashboard, you're also seeing that there's on the Connect4, there's an agent training materials. This is new, and we love this. So I'm going to click on this first. So if you go to here, you can see there's documents and then there's videos. So with any of the different types of things that you can do in the Connect4 platform, there's some training information. So for example, the provider search. So if you want to look up doctors and add them to the plans when you're doing your searches, there's a way to do that, which I am going to go through, but there's also some training here. So if you click on the video, it goes to a YouTube. YouTube's always good. Usually it'll show up a little bit of a commercial beforehand. It didn't this time. You can see this video is only 1 minute and 37 seconds long. So it's quick hitting, but it'll show you how to add providers very easily in the system if for some reason you forget out. Also, if you'd rather have a PDF version of that, you can see right here, provider search. There's a PDF document you can print off, save to your desktop on your computer, laptop, whatever it may be. So it's an easy reference for you as well. So they're making a lot of training materials handy, which I think is a great enhancement to the Connect4 platform. Oh. So again, I like to use the previous button here as opposed to up here. I think there are some locations in the system where you might screw up your output if you're not doing it that way. So back to the dashboard. So up top, you can see it looks pretty much the same as 2021 dashboard or homepage. Plans, you click on here, you can put in a zip code and you can go right to plan data. Search, you want to look for an existing beneficiary. Remember, with both Connect4 and Sunfire, if you did business in there last year, for example, that client data has been also incorporated into the updated sites. So this way, if you've got a client who's on 15 medications, you don't have to add the 15 medications again, right? That's just a time-saving function, best practice. So this way, you can easily just run the 2022 plans, see if the plan they're in, they should remain, or if there's something better that you should move them to, and you don't have to re-enter all that info. So you can search for beneficiaries in here. If there's somebody new you want to add, under new profile here, you can see you can add a new beneficiary. And real straightforward. Everybody knows the universal asterisk is the required data. So I'm going to put in some of the required data. Bucks County, Pennsylvania, where Pinnacle is located. I'm just going to put in some dummy info. Okay. Now, email is not asterisk, phone number is not asterisk, home address is not asterisk. But if you have that information, I would suggest you enter it here. Once you get to the enrollment, anything that's entered in here will automatically pre-populate, so it'll save you some time during the enrollment phase when you're finishing up the application with the client. This way, you won't have to enter it at that point. So you can easily just, for example, put the info in, even though it's not required. If you don't have it or don't want to put it in, it's not going to keep you from moving forward. So at the bottom, you can just save the client here, or you can start adding some preferences. You can go right to a scope of appointment, or right from here, you can go to the plans. Now, for me, I think it's always a nice little add-on to add the preferences. So the preferences are items like prescription drug information, pharmacy that they like to go to, providers like their primary care physician. So we can enter some of that type of information. You can put in as much or as little. You can skip some of the sections. It's not going to keep you from running an illustration. The more you put in, it's going to save it, the better outcome you're going to get in the plan data at the end of the day. So we're just going to say we're looking for a MAPD type plan. Do you receive help from Medicaid? So is your client a dual eligible, Medicare, Medicaid? Do they get any type of assistance through Social Security? Are they LIS? They get in a little bit of help with their Part D premiums. If you don't know, you can put you don't know. You can put I am not eligible. You can leave it blank and you can skip it. It's really up to you depending on what you know. So right for example's sake, I'm just going to say, I don't know, hit continue. Alrighty, so health questions. So here is where you can actually toggle between someone who might doctor more regularly than somebody else. So if they're on a bunch of meds, maybe they're a diabetic, they've got a heart specialist. So maybe they're doctoring more or less than other individuals. This is actually going to take into account really just how often somebody goes to the doctor. And the only thing that's really going to impact is in your output, the total estimated cost. So if you're going to the doctor once a month versus once every 2 months, it's going to impact the overall out-of-pocket cost. So that's where this comes into play. If you want to just say, hey, somebody's sort of a quote-unquote standard type health, maybe we just say some health needs, ongoing condition like diabetes, regular prescription meds, one or more visits to a specialist. But again, you can change that. It's not going to greatly impact the results except for the out-of-pocket cost. Again, those are estimates. 65 to 69, it's already there because I put in the date of birth. Hit continue. So the provider section, here's where we can say, hey, somebody goes to a certain doctor. I typically use my good friend Dr. Topkis because I know he shows up in our zip code. Simply add them right there. But you can also add, for example, hospitals and different types of places like that. So if we're going to add Doylestown Hospital, here we go. Add provider. Boom, right there, right? Providers. We got Dr. Topkis and we've got Doylestown now added. So both are now doctors that we are saying that are important for this client. So again, you could have skipped this, but I like to put more information if possible. So we'll hit continue. All right, here's where we can put in some prescription drug information. So I'm just going to put in a couple. Now, if it's highlighted, that's what Connect4 is saying is the usual. You can obviously toggle between those, pick the right one, hit add. Let's just, for example's sake, we'll just add metformin. Again, we can add. Now, both of these medications are added here. MyMedicare.gov, this is also known as the blue button. So if somebody has a MyMedicare.gov and you'd like to pull their true claim data from their Medicare account, you can do that right here. They must have a MyMedicare.gov account for that to work. So if they don't, you can skip it or you got to set one up. Let's just hit continue. Pharmacy. So here's a cool feature Connect4 added last year where you can add multiple pharmacies because pharmacies do matter. Is it a preferred pharmacy, standard pharmacy? And the copays could vary based on that information. So CVS, pretty well known every other corner. We know there's CVS. Let's just add Maxwell, right? Maybe it's a mom and pop one that's also in this area. So you can see both pharmacies are added right here. I've got CVS as the primary, but we could change that easy enough, and we're still going to be able to check both of them pretty easily. Let's just hit continue. All right, here's a new feature for 2022. So Connect4 is now going to allow you to select if any of these features are important for the client you're working with. So is having a dental plan important? If it is, when they do the output on the plan data, plans that have dental coverage are going to show higher up in the output because we're saying that's important. You can skip it. You can leave it blank. If it's something here is important and you want to reflect that in the output, check it off. Now here also, do they have any of these chronic conditions? So those of you that have been in the MA market are familiar with SNP plans. There's also the chronic SNPs. So if somebody, for example, is a diabetic, if there's a chronic SNP and we want to make sure that we capture that information, we can put that in there as well. Again, it's just giving a little more info to the system saying, hey, this is my client. We're building that picture of the client, and we want to show the best plan options that are available for that individual. So we can uncheck it. We can leave it blank. I'll just leave it blank for now. Hit continue. So all of our data is in, all our preferences. Now the system's going to give us some plan output. So you can see our training site, it's going to show all the different plans. Now just keep in mind that if you're contracted with Pinnacle and you're contracted with one carrier is going to show up for you because we are using what the carrier has given us of the agents that are quote unquote ready to sell. It means you've done your certifications for that product so you can enroll individuals. We have to know that because if the enrollment's made available to you and you're not certified to enroll and something happens, again, you're not getting paid for that case. So we never really want that to happen. There's also, it's not available for another week or so, but there's going to be a button right here that's going to say show all plans. So let's just say you are contracted with just one company with Pinnacle, so only one carrier showing up. If you click that show all plans, it will populate every single plan option that is approved by Medicare. The only thing that it won't have is for all those other plans except for the one, you're not going to be able to enroll individuals. But you can do product comparisons that way. This way you can actually see the data on all the other plans that are out there. So I think it's a great tool to be able to use. Like I said, CMS is going to release that here in the next week or so. So Connect4 will be able to have that. Sunfire is going to have that as well on their site. So again, when I say 90-95% of the two systems are pretty similar in the functionality, that's one of the things that is nice about this. So sometimes it's just which one do I like better for you as an agent to choose from. So you can do MA only plans as well. So if say you're working with a veteran, you want to do an MA only plan. If you have somebody who's a Med Sup client, you want to do a PDP standalone, or you want to take a look at Medicare supplements. Now Connect4 definitely has more Medicare supplements available to be written through the system. Right now, Sunfire only makes available Anthem to enroll through their system. So if you want to sell United Healthcare, for example, through the Medicare supplements, through Connect4Medicare, you've got to use the Connect4 platform. Okay, so you can see here, Pharmacies, CVS, we had as our primary. You can see total estimated cost, $2,025. 2 of 2 prescriptions covered. Pharmacy, CVS, right? Makes sense. If I want to switch it to my mom and pop Maxwell, I just simply click there. You can see it changed to Maxwell. 2 of 2 covered. Look at this. It's actually a little bit of a cost saving. So for this client, you're talking to Mrs. Jones and they got a CVS just as close as a Maxwell. Maybe they go to the Maxwell and they save a couple of bucks. Just depends. It looks like it's only a couple of dollars, so it might not make a huge difference to them. Sometimes it can. It just depends. But you have the option to show both there. You can also show mail order. So there's mail order cost. You want to do a 90-day supply. You can do that as well and show that information. Just go back to CVS as our primary there. 2 prescriptions covered, right? Insulin savings program. Now, this came out last year. Those of you that have been selling Medicare Advantage have seen the new government regulation that really came into place that pretty much said that if a carrier is part of this insulin savings program, they cannot charge more than $35 for the insulin. Not all carriers have to be part of that, but if you want to see which ones are, just simply check that off. And the plans that are now showing are only the plans that are part of the Insulin Savings Program. If you want to see only the Aetna plans that are part of the Insulin Savings Program, you can do that as well. So you can really toggle and sort of mess with it as much or as little as you like. Bottom line is that in seconds, you're the expert on every single plan. And believe me, there's a lot of data in here. If you didn't have a system like this, honestly, I don't know how you'd manage. Medicare.gov came out their new site last year, which was, I'll be kind and say it didn't work well. And it's not a lot better this year from what I've been seeing. So it's really nice that you have access to a site like this. So I'm going to get rid of the insulin there. You can pick HMOs. You can do a little other preferences. Now, here are those initial preferences we picked. If you want to change your prescriptions, you want to change your pharmacies, you want to do any of that type of information, you want to add the dental and see what that looks like, you can do that right here. So you can make those kind of changes, and it's pretty easy to do that. Right over here, we're going by the preferences. So again, based on the fact that did we put in dental, vision, and hearing, did we put in that my client is diabetic. If we want to change that to the total estimated cost, and I think that's probably what gets used more than any other filter, because at the end of the day, it's okay, which plan is going to be the least expensive overall for my client? And I think regardless of whether maybe they're in the insulin savings program or anything else, we want to look at what's the best cost for my client. So I changed total estimated cost. Look at this. I just went down to $1,600. I just saved $300-400 versus the preference score that I got initially. So now all of a sudden AARP is looking like king of the hill for this client, right? 2 of 2 prescriptions covered. We got CVS. We're good. So everything is in place. It's a PPO, so real strong type plan. So that's what you can do with this pretty easily. If you do want to add SNP plans, you can simply click on this little button here. So again, if you know your client is a duly enrolled Medicare, Medicaid, you want to see the SNP plans, you can do that real easily right there. Easy enough to remove them as well. Again, these are plans that you are ready to sell with Pinnacle Financial Services. Unless you select that show all plans button that's not here, you're going to have to use your imagination here a little bit for me today, but in a week or so that'll be populated, and then you can see all plans, and that'll be easy to do. I am going to take a breath. I went through a lot of info there, and I do see there is at least one question. Let me see. So there's a question on the Part B rebate. So if you want to look at plans that are part of the Part B rebate, you've got to do that from the preferences. So you would have to go back here, edit, that you want to see plans that offer the Part B rebate. There is a question if the costs get adjusted if somebody's on extra help like LIS. Yes, absolutely, there is. If you do put in there, if you remember in the preferences, we were putting in there, does your person get any type of help from the government? You can actually check that off, and it will adjust the premium. So let's, for argument's sake, maybe I can go back in here real quick. I don't want to keep everybody over time here, but let's just show that real quick. The profile's up there. Hit it to me there for a second. That's okay. And we'll go through. I'm not going to go through all these again. Obviously, I've entered that information, but I want to get to the do we get any help? So here's where we can start marking off. Do we get some help? We continue. Now we're changing our filters. Okay. On the other preferences, again, this is where we can add information like, do I want to take a look at a plan that offers a Part B give back important? Here's where we can do that on the Part B give back, which is under the other preferences. It's also going to be available on Sunfire, and I'll show you how to do it there. Also, I'll just leave it checked off. I'll get back to our output here real quickly. And again, it's very possible, depending on your area, there may not be a Part B give back plan. I mean, that's always a possibility as well. So here we go. I made some changes here. I put in some preferences, and let me see here. Yeah, there must not be a Part B give back plan in this area, but it did adjust. It did adjust the premiums. Let me just go to total estimated cost, which I like. I think that always shows the best. Total estimated cost now is $1,204. So I haven't changed any of the other input. So I have 2 prescriptions in there, the same ones. All I did was say the client gets assistance with their cost. And now we can see it went from $1,600 to $1,200. So the adjustment on the annual cost was made. If you go into plan details, you can really dig a little bit more into the month to month and the cost as well. So here we go, plan details, estimated drug cost, 0. There you go. So it zeroed it out for me, and you can check that out over here as well. If you go under total cost, you can look at it month by month if you want to see. So right now you can see, because of the assistance, we got zeros on the board. So pretty cool stuff. All right. So one other thing I do want to, I should say 2 other things I want to show in the Connect4 site here real quick. If you go under your name, so this is our test site. It says Pinnacle Financial Services Training. If it's my site, it says Bob Brisky. If I go under here and go into Account Overview, here's where I can find the Pearl. Now, the Pearl is like your own website. In essence, this is a consumer-facing, CMS-approved and compliant, ready-to-go site that you can use, that clients can sign up directly. You do not need to be involved. And not only will you be agent of record, but you will get paid full comp as you would as if you were sitting right across from the person. So you can see the URL is this great Pinnacle6.DestinationRx. If you need and don't have another domain, we can help you set that up, and we can link this to a much easier domain. So maybe if you're in Pennsylvania, you want to set up a domain that's Pennsylvania Medicare Advantage Plans.org or something a little bit better than this URL. So if you call Rob Valencius, that's Rob Valencius, extension 7701, who's also in the website contact that I showed earlier. He's our national agent trainer. He helps agents all the time get the domain set up, shows you how to do it, show you how to connect it. This can be live for you for this AEP. You can put it on your website if you have an existing website, however you want to go ahead, and we can certainly help you with that. So that's the Pearl, the personal URL, as they call it. And the last but not least, I want to mention HRAs. So the health risk assessment. Many of you have probably been doing these for the last year, and I would suggest those of you that are not doing it that you should be doing it, because it helps the client. The carrier will actually help set up any type of screenings, any type of preventative appointments. So they'll really go through a lot of health info that will help the client manage their health. But also, you as an agent get paid for doing this. So as you know, with AEP, you don't necessarily get paid right away when you're writing these cases. It could take a little bit, a couple of months. But if you're doing the HRAs on those, the carriers actually pay them pretty quickly. So at least if you do a bunch of the HRAs, you're getting a little cash flow going during the AEP timeframe. And you know, if you're helping the client at the end of the day, it's a good thing. So I think it's a win-win all the way around. Now, not every carrier has approved their HRA for Connect4 and or Sunfire. So right now we have ready to go for AEP. We have Aetna, we have Humana, we have Anthem, and we have WellCare. The big one that's missing, obviously, is the United Healthcare, which we are diligently trying to get them to see the light to get this on there. I cannot say for sure that it will be this AEP. I can only hope. Fingers crossed. If that happens, you'll see a lot of information come from us on that, because that'll be great news. But as of right now, if you want to do the HRA with United Healthcare, if you do, you're going to have to do that through their lien site, for example. So that is the Connect4 site 2022 in a nutshell. So right about 30 minutes. I usually do Sunfire a little bit quicker because it's repeating a lot of the same info, just laid out a little bit differently. So again, Sunfire is one link. So I'm going to click on the Sunfire, and I'm in. I was already logged in from earlier this morning, so it logged me right in. Again, this is Pinnacle's test site. So here is this dashboard, and you're probably, if you've used Sunfire, you can see it hasn't changed one iota. It's still the same. You want to run quotes, you do them from here. You can send scope of appointments. Again, what's really nice with scope of appointments with Connect4 and Sunfire is you can email them, you can text them. You can even upload it if you've done a paper copy, and let's just say you did an enrollment through Sunfire and you wanted to upload that paper to the client. You could absolutely attach it, and this way you'll have a record of the scope in the system. So it's always a nice, easy way to do. If you just click email scope, if you want to email it to them, you can see it looks just like a regular scope of appointment, the one that you have to do before every sale, right? So you don't have the old 48-hour waiting period any longer, but you still have to do it. So on the scope, you'll see the dental, vision, hearing, the ancillary health products, hospital indemnity are on there, med sup. I say check them all off because at the end of the day, you might get asked those questions, and you'd certainly rather just have it on the scope and not have to redo the scope. So hospital indemnity, if you're not set up for the HIP plans, I always suggest that you definitely do that. You can sell it at the same time as a Medicare Advantage plan. I will just use a generic. Most Medicare Advantage plans have some type of copay when it comes to hospitalization. So if it's, let's just say for easy numbers, it's $100 a day for 3 days that a client will pay out of pocket for a hospitalization, you could actually very inexpensively get a hospital indemnity plan, which will pay $100 a day to the client. This way, you sort of close that gap in essence. And again, hospital indemnity plans are going to pay during AEP, right? Again, that's cash flow during the selling season. So I'm going to just go back to the dashboard, quote and enroll. We can do that right from here. So is this something where we want to add a new contact or look up an existing contact? We can do that. We can just put in a zip code and we can go to the plan information from here. So let's just go here. We can search contacts. We have somebody in there for last year, for example. We want to add a new contact, which I'm going to do just to show how easy it is. Again, asterisk, must do, no asterisk, not required, but would probably make sense to do it. This way you won't have to do it on the back end. Okay, so want to run a quote. So a couple of options again here. I got 18974 as our zip. We can just go right to the plans, or we can quote unquote add preferences. So same way that we could add some of that stuff in Connect4, we can add it here in Sunfire. They don't necessarily call it preferences, but same difference. Medicare Advantage Part D. Here is where the 2021 and 2022. Remember I said it's only one link for the plan years. With Sunfire, unlike Connect4, here's where you can say, hey, I want to look at 2022 plan data. Make sure you check off the right plan before you start running them for the client. Right? Makes sense. Is the client taking prescription drugs? Yes. Okay. Pharmacy says CVS. I can change it to mail order. I can change it to something else if I want to. Sunfire doesn't do the multiple toggle between pharmacy feature. Here's one of that 5% differences that I mentioned earlier. So if you want to change pharmacy, you'll have to, you can, it's easy to do, but you can't toggle between it in the same way. And I'll show you that once we get to the plan output. Let's just say we're going to save that information. Okay. Are you taking prescription drugs? We have that in there. Pharmacy, we've got CVS. Here's where we can also put some of the important things to us. Is dental coverage important? right? Is insulin savings important? Is transportation benefits, are they important? And these little arrows, you can actually change it and say, you know what? Transportation is actually the most important thing. So you can change that. You can take it off. Again, if you put that information in there, it's going to take that into account when it's saying, hey, this is the best plan choice for this client based on the data you put into the system. You can also put your providers in there. Easy enough. Let's just, again, I'm using our good friend TopKiss. All right, takes a second, but you can see there, I can add hospitals. Now, like many providers, hospitals, they might have different buildings depending on the types of services you're receiving. So the Sunfire actually shows that these are the ones that are being taken into account. These are the buildings. This is the main building for Doylestown Hospital. So I'm going to send that. So you can see I've added TopKiss, I've added Doylestown. I can just save it at this point. Am I currently enrolled in Medicare Advantage or prescription drug plan? Again, here's a little wrinkle that I'm going to say goes in Sunfire's favor that Connect4 doesn't do. But if you have a client and you want to actually compare against their existing plan, it makes it really easy to do so. So let's just say they're in an Aetna plan. I'm just going to pick that arbitrarily. This disclosure, if you're doing this, it's got the little asterisk, right? So you've got to check off that box. Here's how often you're doctoring. It's the rarely, occasionally, frequently, I don't know. Again, you can skip it. If you're picking occasionally, if I hit this health usage estimates, it'll tell you, hey, based on occasionally, I'm saying your client's going to the doctors about 10 times a year, maybe one emergency room visit. It's going to give you some of that data. So you can say, well, you know what? Probably not that often. Maybe I'll pick rarely. So that's 5 doctor's appointments. So you can toggle there pretty easily. Do they need help with LIS? Again, we can show the LIS stuff. Let's just say yes. You want to adjust the premiums. If I pick this, it's going to adjust the premiums to the right amounts for your client. If I don't know, if I want to pick no, that's fine as well. You can also adjust all of these filters, all this data, once we get to the plan output. So then I'm just going to say view all plans. Okay, so here at the top, this is my current plan. It's always going to show first if I put in a current plan. So what you're going to see is the total estimated cost. But in the next plan, it's going to say this is the most recommended plan. It gives it a 10 score. You can see as you go down, next one's a 9 score based on what we put in. So you can see I am saying that this plan is going to save this client $194 for the year. So $332 is the out-of-pocket here. I'm going to, my $138 is my estimated out-of-pocket for this plan, which is $194 saving. I hope that math is right. I'm not doing that in my head. Doylestown and TopKiss is included with the current plan. It's also included in this number 1 recommended plan. So you can see how easy that is. Put in the info. As much as you have, better off you are. And you can start getting that info. Little filters are different on the side here. You can switch between them. You want to pick special needs plans. You can change it. Now you'll see just the special needs plans. You want to go back to the MedAdvantage. You want to look at plans with a Part B give back. You can take a look at it here. You want to try and find a 5-star rating plan, plans with hearing benefits, dental coverage. So you can sort of mess with those filters here as well. If you only want to look at Aetna plans, you can do that. Again, the only plans that are going to show here for enrollment purposes are the ones that you're contracted and certified through Pinnacle Financial Services. And this way we know that you are good to sell, because if you hit the enroll button and enroll somebody, you're going to get paid and be agent of record. If you want to see other plan data, you can actually uncheck this and you'll see all the plans. But again, you're not going to be able to enroll in those other plans. But for comparison's sake, it's going to allow you to do that, which is nice, right? It does give you that ability. So you can see here, if I want to change the plan that they're enrolled in, I can simply click here. If I want to change CVS, again, I don't have the multiple pharmacy that I can toggle between, but if I click on the CVS and I want to change it to, let's just say Walgreens, I can make that change and it will update. Okay, so easy enough to do there. Now you can see Walgreens is showing 2 medications. I can change that. 2 doctors, Topkis and Doylestown in there. I'm saying they see doctors rarely. So a lot of ways to put the data in, adjust the data, real time, real quick, real easy to do so. You can compare plans side by side. You can even send these comparisons in both platforms to a client. So if you're working over the phone with somebody and you want to send it to them and say, hey, I've done all the legwork for you. Here's your existing plan. Here's the number 1 plan for 2022. Here's why I'm going to save you $374 by changing plans. You got both providers. It's a no-brainer. We're going to go Humana this year unless for some reason you really want to stay with Aetna. Your call, right? At the end of the day. So you can send that to a client and show it to them over the phone. You can, if you're doing it through the broker site, you can have the entire enrollment filled out. But when you get to the signature part, you got to email the signature. You can do it while you're on the phone with them, obviously. They're going to have to click on the email that they get. Again, this is where if you've already put the email in for the client, it's easy to do. My enrollment's not live, so I can't do that for you today and kind of show that. But if you do enroll and then you send that information to them, once they click on the ESignature, you'll get a notification in real time. Hey, good to go. App submitted. You're done. So if you're doing it in front of them, of course, even easier. You can actually just do the ESignature with them right there if you're doing it in front of them. So makes it real simple, straightforward to do so. I'm going to, again, take a breath here and take a look at questions. So questions regarding the 2022 versus the 2021 version. Remember, when you go to, I'm going to show this. When you go to our website, if you go under Connect4Medicare, if you're using Connecture, you've got to choose the appropriate link. You want to do 2022 effective dates. So this one, 2021 effective dates, this one. For Sunfire, it's the same one. When you're adding the preferences, you're just picking the plan year that you want to illustrate. So it just varies a little bit there. HRA. So I didn't talk about the HRA age yet on the Sunfire. So once you complete the enrollment, automatically what you're going to be able to do is you're going to be able to click on a button that says complete the HRA, and it's going to take you to the HRA site to complete. Once that gets done, normal procedure, you get paid as normal from the carrier. Again, I can't complete an enrollment, which I apologize, but just not live yet, so that I'm able to show you what that looks like. I do have a hard copy. If you want to contact the sales team, I can have them send it. It's a one-pager that will show you what the HRA button looks like. In essence, it just looks like a button that says complete the health risk assessment. You click on it and you go from there. So really easy to do. All right. Okay, usernames and passwords. So every agent that is licensed, certified, ready to go for any plan with Pinnacle Financial Services, you have login credentials that we have automatically set up for both Connecture and Sunfire, whether you realize it or not. Contact the support team to get your login credentials, and they can give those to you. They are different for each one because there's different rules each provider gives us to create for that, but you have access to that. So again, if you go to our website, 800-772-6881, you want to contact our support team, or if you email support@pfsinsurance.com, just click on that and say, hey, I need my Connecture and Sunfire ID and password. Please send it to me. They'll send it to you. That'll go right to our support team. They will do that for you ASAP. And I would suggest to everybody on here, whether you've used Connecture or Sunfire before or not, to go into the 2022 sites now and by now I mean before October 15th, to make sure that the plans you feel as though should be showing up for you are showing up for you. What you don't want to have happen, obviously, is it's 10:15, you go to write a client, and all of a sudden a plan that you think should be there is not showing up for enrollment. It shouldn't happen. Check it, right? Go in there, get your credentials. If you already were in Connect4 and Sunfire in 2021, your credentials are the same. We haven't changed them. So you can just simply click on the 2022 link for Connect4, and it should have that already saved for you. And then for Sunfire, same thing. You should be able to just go into it. It's the same login credentials. Okay. Updated Pearl. So yeah, Pearl, the personal URL, and I didn't show that yet for the Sunfire, but let me do that. So going back to the Sunfire, so this says test site. It'll say your name. For me, it will say Bob Brisky. If you go under profile, so the Pearl again is that consumer-facing site that you can use to promote yourself as much or as little as you want. So right here, you can simply hit these two little things. That'll copy it. There you go. You want to update this to make sure that you have the right URL attached to your website or domain that you purchased for the Pearl. It looks very similar to the Connect4 one. Obviously, it's a little bit different, but in essence, client can come here, put their information in, kind of run through the stuff on their own. If they sign up, you're paid, your agent of record, same as if you were sitting across from them doing a paper app. Same deal. So you can use this Pearl as little or as much as you want. And again, Rob Valencius, he knows I mentioned his name many times on these calls, so he's expecting some people to reach out to him. Okay, so here is, let me see, any other, can you review where to locate the HRA? So again, on the HRA, once you complete an enrollment, so the enrollment gets completed, there's going to be a button that shows that just says go to the HRA. That's just, at the end of the day, it's very easy. Let me see if I can find the one page or I can show it on the screen here. Give me 1 second. I do have it saved here. Okay, I found it. All right. Let me see if I can show it on the screen. Here we go. So here is the one for Sunfire. Since I was in Sunfire, here's the one. Here's how it works. I can, of course, send this on over to you here, but success, you've completed the enrollment. It's right there. Make it a little larger. Success, enrollment completed. Start HRA. Oh, stop clicking on that. Start HRA. You can start it right there with Aetna, right? What did I say? Aetna, Humana, WellCare, Anthem, right? No United Healthcare. I hate saying it, but the fact's the fact. We're going to try and get them on here sooner than later, as soon as possible. Here's the HRA for Sunfire. Let me just close that. I have Connect4 here as well. Here you go. Connect4. Your application has been submitted and is pending approval, right? Hey, application's completed. Next steps, complete health risk assessment. Again, it's just a little button you click. Let's get it going, right? Easy to do. This little cheat sheet there will show you how to do it. It's a little walkthrough. Everybody on this call, if you want the cheat sheet, just send an email to the support and we'll make sure that you get it. Again, on our website, support@pfsinsurance.com. I need the HRA sheet. That's all you got to say. We'll make sure you get it. All right. Let me see. Any other questions? I would also just tell everybody, your sales team's here to do one-on-one walkthroughs. Make sure you get in there. Make sure the right plans are there. Support team. Everybody's here as much or as little as you need. Get into the system. Make sure it's working. Make sure you understand it. Make sure you're ready to rock and roll come the 15th. That's when we want to make sure that everybody's getting their enrollments in and everything is working smoothly, right? This year should be unbelievable. Last year, Last year was actually better than, better than we thought it was going to go with all the COVID stuff. Obviously, that was a tough one to deal with in many circumstances. But it's just one of those things where this year we're as close to normal as we've been, and in most places we are pretty normal. So, going to be a great year. Let us help you any way we can. You want to get started on some lead programs that you haven't taken advantage of, give us a shout. Make sure we're in the system, and we'll be good to go. All right, everybody. I'm going to end her there. I hope everybody has a great rest of their day, great weekend. Here's looking to an awesome AEP for all of us, and anything we can help you with, don't hesitate to give us a shout. Have a great day. Thank you again.